Good afternoon, everybody. It's so great to be with you, to feel this energy on a Friday afternoon when you've got Cookie Monster out the door. It's really a pleasure to be with you, and especially around such an important convening. I so appreciate ICPH and the work that you do, and for creating these opportunities to come together to think about how data do in fact merge with action around homelessness and poverty and the key challenges facing our country. I am really excited about the theme, the conversation, and the breadth of the people that are coming together in this room today. I've hijacked it in the title of my own presentation, and we'll use it a little bit today. Of course, housing is essential to ending homelessness, including youth homelessness. And this is no truer now than it's ever been. We have an incredible affordable housing crisis throughout this country. The city's a great example. A young person can't even get a room share in most cases without for much less than $1,100. And we are really looking at a severe crisis, and we can't end homelessness without housing. At the same time, ending homelessness, and particularly youth homelessness, and I'll talk more about this, is really about so much more than four walls and a roof. And this conference gives us an opportunity to think about that and to have a conversation around it. So I'm going to share a little bit about my own thinking with that in mind, and what the evidence and the data, as well as some of our experiences, are signaling with respect to going beyond housing. So first, I think it's really important to put this work into perspective. Beyond housing means investing in young people's potential. If you talk to, I've interviewed and included in focus groups hundreds, if not thousands, of young people that I myself have directly contacted. Very few, if any of them, have said that their goal is just to get housed, if you ask them where they're trying to go. Their goal is so much bigger than that. A house, an apartment, stable housing is one pathway to a bigger picture towards fulfilling their potential. And really, that's so critical for us. So the reason we specialize on youth homelessness is not because we think other forms of homelessness aren't important. In fact, they're often interconnected. But when homelessness occurs during adolescence and young adulthood, it takes place during a critical developmental period of our lives. We often think about the developmental period during the first 1,000 days, right? This is my little person, thank you. I feel that way too. And we often hear about the importance of the first 1,000 days, right? How many of you have heard of that? Yeah, everybody has, right? And we know about the massive organizational development in the brain and the growth that's happening during that period. And I get this up front and in person now, and I get more exposed to it than I ever did. At 1 year old, he was usurping my smoothies. At 2 years old, he moved from no to no way. Now, just having turned 3, he insists that I'm not a real doctor. If only PhDs came with a lab coat or a white coat, it would just make it so much easier to convince him. So that growth, that transformation is really happening during this stage. But what we don't often think about is the incredible transformation in the brain that is also happening during adolescence and young adulthood, from about ages 12 to 26. This is a major reorganization and a major growth development period, particularly for the 4th stage of brain development, and that's the prefrontal cortex, which is responsible for executive functioning, planning, emotional regulation and control, complex thinking, really essential stuff that we carry throughout our lives and shape the way that our life course develops. If that stage of our life is spent being empowered and nourished and supported, that can be an extraordinary window of opportunity. If that stage of our life is spent experiencing homelessness and housing instability and the trauma and adversities that are associated with it, then that is a major missed opportunity, not only for those young people, but for the communities in the country that they live in, the economies, the society that they are meant to contribute to. And so we really need to think about the critical stage that we're in as we're going beyond housing to really realizing young people's full potential and helping them get on a path to thriving. But to do this, we have to go beyond housing to make the invisible visible. And this has personal significance to me. I am certainly a big nerd. I like long walks on the beach and evenings of designing unbiased sampling strategies. I judge people's character by the standard errors, but that's an awful one. But really, you know, I'm a big nerd, no doubt about it. But I came into this work in a personal way. I was a lucky young person, but I lost both my parents at a young age. I grew up in a home of significant substance use, mental health problems, and police visits. I ran away many times from home. I was angry. I was frustrated. I grew up in Florida. But I always came back because somebody had to pick up my baby sister off the floor when no one else would. But I was lucky because at age 14, a high school English teacher spotted potential in me when no one else did. She thought maybe I wasn't being challenged enough, because even though I was quiet and introverted, she saw me really grappling with characters in literature, and that was actually my outlet to reflect on my life and what was going on in the world around me. And so she thought maybe I wasn't being challenged enough. She didn't know all what was going on, but she was also a volunteer at the time for a group of young people coming together with adult partners in our community who were challenged at the time by Hillary Clinton as First Lady in the Millennium Celebration to do something positive for their community. Some youth were painting murals, some were planting trees. In our community, young people decided that wasn't enough. They wanted a teen center, and they wanted youth to run it. And that's when the adults started to realize they were getting in for a little bit more than they realized. But those like Mrs. Lippman, my high school English teacher, decided to stick with it. And my teacher kept coaxing me to come along, and finally after 2 months I went to get her off my back. And the experience changed my life. These were not student government leaders. These were young people from the community who were empowered and entrusted to do something big. And those young people did everything from painting the walls to interviewing, hiring, firing adult staff. Now, you want to see a nervous adult? I mean, this is... But the adults who stuck through that process, we knew were committed to authentic youth collaboration. And together, we got our first grant from the county of $200,000 when I was 16. When I was 17, a family foundation was really struck by how radical this was and gave us $1 million to build out 5 more. It was too much money. It didn't all go that well for a bunch of 16-year-olds to have that much money, but some of it went well. But the trust that placed in us was incredible. A little bit of it went to Jello wrestling, but really it was an extraordinary experience. And I was invited to come to the White House's first National Youth Summit when I was 17 to give their first keynote to speak to my experience and our experience as a community. And ever since, this introvert has been launched into the youth advocacy scene. And so this has been quite a journey for me. But not all young people are so lucky. This is my high school English teacher here with me and my teen group. Don't ask about the necklace. It was Florida in the 1990s. But these are the young people and our adult partners in building up our first teen centers. But not all young people are so lucky. Take this young person, for example, who I spoke with about a year ago. I was sleeping on the streets before I got arrested, they said. Sleeping in a bus station or in motels when I could. I took drugs not to think about it, not to think about the fact that I might not have somewhere to stay, that I might have to sleep on the street. I'm ashamed of it. I just wanted stability. I didn't have anything stable, anywhere stable to live. I just wanted stability. This young person also happened to be my little sister. And to give you just a sense of how even within the same family unit, household unit, trajectories can be so different in this country. My sister has had incredible resilience, but also came out as gay at a young age, was exposed to a huge amount of adversity in and outside the home, and has continued to experience homelessness even up to very recently. And I was angry, and I am angry, that we have a country in which we have lucky and unlucky youth. I am angry that we have to rely on a teacher who, without resources or systems, happens to come across some young people and supports them, but other young people, so many young people like my little sister and many, many, many more, go under-realized in their potential. And I'm angry that they remain invisible. And so I got into research and data because I'm a nerd, but also because I believe that good evidence and data can make the invisible visible. I believe research and evidence can help shed light on our blind spots and show us as a society, as policymakers, as decision makers, where we need to pay closer attention. And so I'm really excited that I've been able to be part of this work at Chapin Hall, which was to establish Voices of Youth Count, the most comprehensive national research initiative to date on youth homelessness. It's a partnership of private foundations and many national partners in 22 counties from across the country. And Congress appropriated funds, and HUD, HHS, Department of Education, USICH, several federal partners have all been invested in this work. So it's been a really tremendous and unique public-private partnership around data, around nerdy stuff, so that we together could make the invisible visible. And it's amounted in a whole range of publications, some in academic journals, but also a number of research to impact briefs, evidence summaries on different types of programs, everything we could pull together on different subtopics of youth homelessness, and we've made all of it freely available to the public. So everything we have you can get on our websites, and I hope you will, even if it's to say this stuff sucks. Have a conversation about it, build a dialogue, use evidence to drive conversation and action in your community. So I'm going to share a little bit of highlight of what's emerged from this research so far. First of all, we found that this really is a broad and hidden challenge in our communities. We did the first nationally representative survey of youth and young adult homelessness ever conducted in the United States. We found that 1 in 30 adolescent minors ages 13 to 17 experienced some form of homelessness within a one-year period. For young adults ages 18 to 25, that prevalence rate escalated even higher to about 1 in 10 young adults experiencing some form of homelessness in a year. About half of those experiences in the form of couch surfing without a safe and stable living arrangement, underscoring just how invisible, how hidden these issues are. And because we did the first nationally representative survey, we could look at the issue spatially. And what we found was that in rural communities, the prevalence rate was statistically equal to what we found in urban communities. Doesn't mean that there's the same number of youth experience homelessness in both communities, because there are more human beings in urban communities. But as a share of the population, it is just as much of a challenge in rural areas of the country. So this is not an East Coast, West Coast issue. It's not an inner city issue. This is an American issue. This is a challenge we are facing at the national level. But we also saw that youth homelessness looks different when you look at it spatially. In fact, youth in rural communities were, when we looked at the 22 counties and the brief youth surveys that we did in the youth point in time counts, we found that youth in rural communities were about half as likely to be staying in shelters as those in urban communities, often because those shelters don't exist or they're not youth-friendly, and they're about twice as likely to be staying with others. There's actually also a higher rate of literal homelessness, but often even that is more hidden, more dispersed, young people sleeping in their cars, and so on and so on. So this really attests to the fact that this issue is so hidden in our country, and it underscores why we really need better evidence and data to make the invisible visible. The intersections of youth and family homelessness also really struck us. About 44% of young adult women experiencing homelessness were pregnant or a parent. And that, to the exact percentage, was what we found, whether it was the nationally representative survey or using the survey data from the 22 counties where we partnered. This really underscores the intersection between youth and family homelessness issues and the need to bridge that divide. As a country, we treat these as separate, siloed issues, and we have, as you all know better than I do, a very poor cohesion across these systems and services. But we need to think about these as young people who need developmentally oriented supports for them, as well as for their young children and their babies, as well as for the needs of a whole family. But beyond housing, we also learned that we have to center equity. And this is something that also really, I think, underscores the invisibility of the issue. When we look at our data, we found that youth of color across the country experience substantially higher rates of homelessness than other young people. Now, when we say 1 in 10 young adults experience homelessness, I often get pushback by people who say, no way, my daughter doesn't have people, her friends aren't experiencing homelessness at 1 in 10. I'd see it at that level. Well, is your daughter a black or hanging around black or American Indian young people? Does your daughter belong to a low-income household? Does your daughter have less than a high school level of education? If not, then she's right. Or they're right, that they would be seeing lower rate of homelessness prevalence. And this underscores the invisibility of the issue, but it also underscores how important centering equity is to ending homelessness. We simply cannot do it unless we center equity. And I think now, as we're celebrating the life of Dr. King, it's important to reflect on the challenge that he's given us. And Dr. King had said, he looked around and he said, as long as the struggle was down in Alabama or Mississippi of white liberals in urban communities, they could take a look afar and say how terrible people were, how terrible things were. But when they confronted the brotherhood, as he called it, next door in LA or in Chicago, then those latent hostilities came out. We still very much have an othering. We think, well, it's not the homelessness system that's struggling with equity. It's the education system or the pipelines or the justice system. But we're all breathing from the same air, drinking from the same water, and these issues affect all systems. And our data is finding that youth of color are facing longer wait lists. They're getting housed in similar placement rates and things like supportive housing. But the returns to families and the self-resolve exits aren't as well supported and aren't getting the same results. So we really need to think about these issues and grapple with them in a serious way. And we need to think about the intersectionalities that come into play. And this has not really been something we've dealt with for a long time. When I was 17, as part of the Runaway and Homeless Youth Movement nationally, there was a lot of conversation on LGBTQ issues, much less on race. And the national leadership bodies were disproportionate, were very highly white. And so now over the last couple of years, we've seen a lot more emergence of this issue, and it's been really critical. And when we look at our data, we found that for just as one example of the intersectionality, if you are a white young adult who identified as heterosexual or cisgender, you had about 4% prevalence rates of explicit homelessness. For youth of color, for black young people in particular, or for LGBTQ identifying young people, the rates were around 7–8%. But when you looked at youth who identified as both black and LGBTQ, they had 4 times the rates of prevalence as young people who identified as white, heterosexual, and cisgender. So we really need to think about the intersectionality of these issues and how we're targeting supports and services for LGBTQ young people, for example, in communities of color. And these are not intersectionalities that we've grappled with very well on how young people have to navigate services and systems. And my own privilege, of being a white male could have very easily influenced the extent to which I was a lucky or an unlucky young person. And so we all have to grapple with how we've come into places of privilege and think about how the systems might work differently for other people. And not only are LGBTQ young people more likely to experience homelessness by more than twice as much, but among youth experiencing homelessness, LGBTQ youth, and especially transgender youth, are experiencing much higher rates of adversity. These data are from 5 communities where we did in-depth qualitative and quantitative interviews with 215 young people. And we found that among youth experiencing homelessness, LGBTQ youth were reporting about 2 to 3 times the rate of having experienced forced sex, of having to exchange sex for basic needs, of facing discrimination both in and outside the family. So you start to get a picture here, right? And the picture is, it's not good enough for a program to go through cultural sensitivity training. Young people said over and over again in the interviews that we had with them that an organization or a system's reputation was critical to whether they engaged a service or stayed on the streets or in a precarious situation facing more adversity on someone's couch or in an exploitative situation. And that reputation has to be earned. Organizations have to really strive to create a reputation of a safe and affirming environment for all young people if they want to be accessed and engaged by the young people who need them most. Now, Beyond Housing also has to insist on youth collaboration and their agency. And this, I think, is partly in the interest of all of us. I can tell you, as somebody who's been working on youth empowerment and collaboration since I was a young person myself, it's a lot more fun. It's just so much more meaningful and more engaging when our partners, in a deep sense, are the young people who live this experience and expertise every day. But it's also essential to better research, to better data, to better systems. Evidence, as I often say, can inform decisions. Evidence doesn't make decisions. Evidence can inform decisions. Evidence doesn't make decisions. That's where people with lived experience come in. And if we don't have them at the table to interpret evidence and to help us to figure out what questions to ask in the first place, we are very often going to be going down the wrong path. And I've experienced that many times as a researcher on my side. And so we're striving to hire youth with lived expertise, not only to engage them in focus groups, but to literally hire them as integrated members of our research teams and to build them into the processes of community change that we're privileged to participate in. As one young person here in New York City said in the Youth Homelessness System Assessment, the best intervention will be breaking the cycle. It ends up costing you more money to whoever's funding or however it's being funded if you don't solve a problem now. So I think it takes actually listening to us and what we're seeing. Now, this sounds kind of intuitive. It sounds pretty simple. The problem is this logic of putting agency and power in youth's hands, in the hands of people who are in the community, and to actually listen to them, runs against a long, racialized, and deeply institutionalized history of paternalism and social control in our poverty governance. This book is one, among others, that I think just reflects that history so well, and the data about how paternalism has really taken hold of our welfare systems and how our governance operates. So we might be doing it in small ways, but we need to be challenging authorities in our communities to be collaborating meaningfully with young people in much more systemic ways. The other point that I think is really critical is to move more upstream. We have to go beyond housing to going to prevention. Now, this image kind of reflects a lot of the experience of current homelessness response in the United States, and really the response over the last several decades. How many of you have heard the term triage used in homelessness before? Pretty much everybody, right? Now, triage really was popularized in World War I by the French, that's this image here, because they had too many bloody bodies strewn all over the battlefield. And they couldn't apply immediate medical attention to everybody at once, so they had to triage who they would get to first. That is how our homelessness response and how our homelessness policies operated for decades. And it's not necessarily a bad thing that people are responding to a crisis with triage. This isn't really about triage. It's about the fact that we still have to triage. It's about the fact that the failure of multiple public systems, that we are still at war with homelessness, and that we have not worked to emerge out of that war to begin with. And to think of this as the whole of a healthcare or a whole of a homelessness system, to me, is like thinking about the emergency room as the whole of a healthcare system. It just wouldn't make sense. And yet this is exactly what we do. So at Chapin Hall, we think that our research has really elevated the need for a much more comprehensive approach to preventing and ending youth homelessness. And that includes a much stronger emphasis, a public health emphasis, on prevention, early intervention, and on stable exits. Yes, of course we need to collaborate with young people. We need to center equity to improve coordinated response systems around the crisis. We have to do that. We have to address the crisis at hand. At the same time, we're never going to come out of that crisis. We're never going to leave the state of triage unless we start moving upstream simultaneously. And we can't say it will wait. We've been saying that for decades. We can walk and chew gum at the same time, and we have to. Otherwise, we are exposing way too many young people to the trauma and the adversity of homelessness over and over again until they're in such a state of crisis and acuity and adversity that only then can they qualify for reasonable sets of resources and supports and services. And our data sheds light on the opportunities here. In fact, 3/4 of young adults we talk to who are experiencing homelessness as unaccompanied youth had experienced homelessness as minors first. 1/4 of youth experiencing unaccompanied homelessness had prior experiences of family homelessness, again underscoring the intersectionality of these issues. If we really want to address youth homelessness upstream, we need to think about these missed opportunities much earlier and engage multiple public systems to do that. And that's where the opportunity is. If we go to prevention, the homelessness system by itself, or the homelessness set of services, is no longer just the primary actor. They're a support actor. And the other systems that were the support actors before, like education, health systems, juvenile justice systems, behavioral health systems, they now become the star actors. And we need them so desperately. And these data from our 22 counties underscore why. 29%, nearly 1/3 of youth experiencing homelessness on a given night had been in foster care. I know that sounds kind of normalized to us now who work in this on a day-to-day, but when you realize that only 2% of the general youth population has been in foster care, that's incredible. And it's really just an astounding pipeline. When we look at juvenile detention, prison, or jail at the justice systems, or what some are often now calling coming to call the law enforcement systems, what we really see is that about half of youth experiencing homelessness had been in juvenile detention, prison, or jail. And that doesn't even count youth that had other types of contacts with law enforcement or community supervision. And 1 in 3 young adults experiencing homelessness had less than a high school diploma. In fact, this turned out to be the greatest risk factor among all of those that we measured in controlling for other characteristics and variables was the lack of a high school diploma. Here alone are 3 major public systems that could be working together and with homelessness services and systems to prevent pathways into homelessness. And when I show these simple data at communities that don't have these systems at the table, it's really helpful to start that conversation and at least make sure the right people are there, and encourage you to do that too. But just because young people have been in these systems or at risk for homelessness, we shouldn't assume simplistic pathways. This is really important for policy and practice. When I tell people that we found that 29% of youth experiencing homelessness had been in foster care, how do you think people thought they got there? Aging out, right? Everybody thinks that the youth homelessness problem among youth who've been in foster care is a problem of emancipation without supports and services, of being aged out, of exiting into homelessness. Yes, that's a problem, but that's where 99% of the policy attention is. What people don't talk about is that only 8% of youth that have been in foster care have aged out. Only 8%. The other 92% have been adopted, brought back into kinship care, reunited with their families. Those young people share almost equivalent risk factors and profiles as youth who have aged out of foster care. And so we assume that those young people go back into these families or these situations into permanency being fine. Those youth have similar risks for homelessness. And until we start building supports and services around those young people and their families for their long-term success and stability, we are going to continue to see child welfare as a pipeline into homelessness, or at least as an early risk marker. And you could say the same for other systems as well. And in education, I just want to reinforce how important this is. We've just published a brief, a research brief on this topic alone because it was so important. And we found that there really is a bidirectional influence here that's influencing how young people are experiencing homelessness. First of all, as I mentioned, young adults with less than a high school diploma or GED were 4.5 times more likely than their peers who had at least a high school education to experience homelessness. And similarly, young adults who experience homelessness were about 1/3 as likely to be enrolled in four-year college or post-secondary education. So we've got a bidirectional influence here with young people who are experiencing homelessness less likely to achieve higher levels of education, and young people experiencing with lower levels of education less likely to be able to exit homelessness because they can't get into a labor market with livable wages because they lack the human capital and the skills to do that. And youth of color are disproportionate, among youth experiencing homelessness, youth of colors disproportionately have lower rates of education and are facing steeper challenges because of the discrimination they and their communities have faced. So what can we do? We can show what's possible. And I like to use one example, and that's one of running. So I'm an avid runner. This is me over the last couple of years at the Miami Half Marathon and the New York City Marathon just a couple of months ago. And I've been running since I was 13, 14 years old. Apart from literature and teen centers, this was kind of my coping mechanism. That's my little Simba, came to cheer me on. And so I sometimes think in the way of metaphors with respect to running. And I did my PhD at the University of Oxford in England. And in Oxford, Roger Bannister had broken the first 4-minute mile. I had the privilege to meet him before he passed away. And he broke the first 4-minute mile in 1952. Before Roger Bannister broke that 4-minute mile, scientists literally wrote journal articles to say it was physically impossible. Your heart would explode, they said, essentially, was the abstract. You couldn't do it. Roger Bannister broke the first 4-minute mile. Within 6 weeks, somebody else got a 3:58. Within a year, 2 other people broke it. Last year alone, 72 people broke the 4-minute mile. Just last year alone. About 24 of them almost were high schoolers. So once we show what's possible, we can change the game. And I think we can do that in homelessness. So many people think that we're living with the reality of homelessness. It's always going to be with us. How many of us really believe that in the richest country in the world, homelessness has to be an inevitability? It doesn't. It's a matter of priorities. And another example is Eliud Kipchoge. Eliud Kipchoge, just a couple of months ago, a Kenyan, broke the first 2-hour marathon distance. 2 hours. That's 4-minute, 34-second miles, 26.1 times in a row. That is not me. So, I mean, it's painful just to think about it, right? So Eliud Kipchoge did the same thing. Scientists said, impossible, can't be done. And he did it. But let's look at how he did it. First of all, he had some help. Eliud Kipchoge had a group of 42 friends, some of the top runners in the world, who ran with him in teams of 6 and rotated in every 6 miles to help pace him and support him. They were there for Eliud Kipchoge, but they shared this goal together. And Eliud Kipchoge, in every talk he gives, now recognizes the collaboration with these essential friends who helped pace him across the finish line. He had pretty cool shoes, the Nike Vaporflies. Just got a pair myself. They're bright pink. And they really are kind of fun. They're not the same ones that Kipchoge had, but pretty close. He got special ones made just for him. But they've got light carbon fiber on the bottom, really light, good running shoes. A lot of people pointed to that as a potential advantage. Eliud Kipchoge had Patrick Sang, a fellow Kenyan, and his coach. And Patrick Sang saw as his job, his role in life, not as just helping Eliud Kipchoge to run better, but to help him address the life barriers he had in front of him to be able to achieve a monumentous goal. And they had a cool electric car so that it didn't spew emissions in front of the runners, beaming lasers down on the ground so that they had visual data and could track exactly what pace they needed to run the entire 26.1 miles and could follow that carefully and recalibrate if they were coming off of their data points. What people don't talk about, they love to talk about the Nike Vaporflies and the fun shoes. What people don't talk about was the 140 miles a week of training that Kipchoge and his friends had done in high altitude Ethiopia, getting ready for this one moment, for this 1 2-hour moment in his life. So I like to think about this in respect to ending youth homelessness and the hard work that we have to do. Chapin Hall is now partnering with a series of communities across the country on a few innovative pilots. One of those is cash transfers with supportive services to give young people more flexibility and agency to come out of homelessness. So we're in the process of developing and testing cash support and empowerment intervention here in New York City. Another one in the prevention and early intervention field is to partner with schools and community-based organizations and going beyond a program approach to a systems approach to preventing and ending youth homelessness. Just like Eliud Kipchoge had his runners working with him throughout his goal, this model really builds on community collaboration, multiple community partners from members of the community, from parents to juvenile child welfare systems, all at the table, schools and nonprofits and so on, funders all at the table around what we call collective impact, which is multiple entities working around a common goal, coming together to prevent youth homelessness. We have cool tools, not quite as flashy as the Nike Vaporflies, but we have a universal screening tool backed by research where we are working to use research to identify students at risk for homelessness and early school dropout. And in Australia, where we adopted this model from, they identified students and referred them for services and reduced the percentage of students entering the local homelessness system by 40%. And they reduced the number of students who were dropping out of school by 20%. These are not program results. These are population level results. And we have advocacy and counseling. Just like Patrick's saying, these young people need not just a case manager to manage them, but they need coaches. They need life supports for them and their families, and we build that into the program model. And just like those cars provided that data onto the track so they knew exactly where they were at, we're using regularized data from surveys and administrative data so that schools and community-based organizations can have a conversation around how they're doing, not on just results overall, but again, also on equity. And equity is really the centerpiece of this work because it's so easy to be able to ignore it and to achieve inequitable results. Just as Ibram Kendi said, there's no such thing as non-racist. We don't get that comfort. There is racist and anti-racist because any action that we think is so-called race neutral is actually upholding the status quo. And the status quo produces inequitable results. So by definition, any work that we do that is neutralized in upholding the status quo is effectively racist in its results. And so we have to hold that accountability to ourselves in the data that we're collecting. In the juvenile justice field, we went 15 years across this country of state-level reforms to prevent the number of youth coming into juvenile detention. And we have, as a country, reduced the number of youth coming into juvenile detention by about half. That's good news. The bad news is nobody was paying attention to race early on and tracking our progress on race, and we now have a higher share of black and brown youth in juvenile detention than we've ever had before. So if we do not pay attention to equity as part of prevention, we could repeat the same mistakes that we've made in the past. And that's the work. That's the 140 miles a week in high altitude. That's the stuff that people aren't paying attention to, but that our communities have to hold space for. That's the hard work that we have to do together. So I just want to close by saying I really do believe youth homelessness is solvable. I think it's solvable because we have people like you who are committed to this work, who are impassioned, who are willing to come together to talk, to look at data, but not let the data be the end, to bring people with lived experience into the center. I believe we can end youth homelessness because we have to. And I believe we can do it because if not you, who? And because there should be no such thing as an unlucky youth. So thank you for all the work that you do. Thank you.
I don't know about you, but half of me was totally like excited and nerded out by data, and the other half of me wanted to cry because this is it's so touchy. You've humanized the data in a way that very few people can do it, so we appreciate that. We are now going to take some questions, and Katie is back there with the, whatever that's called again, the catchable mic. So if you'll join us for questions for what?
Well, I just want to say first, my name is Andrea. I'm the Chief of Policy Research at the Institute for Children, Poverty, and Homelessness. We're so excited to have you here. We refer to your work so often. It has especially allowed us to talk about things that, like that we know are true, but that we don't have data for, such as past experiences of homelessness, the relationship with the foster care system. And I wanted to ask you maybe about the work that you do, recognizing that need to have data, and maybe in a more systematic way on the work that you, if you're doing any work, to try to promote more systematic data collection for youth in relationship to these areas especially. And maybe what you think providers and others we can do to promote that.
Great. Thank you so much for that question and your comment. So I'd like to highlight 3 opportunities, because I recognize that many of you coming from different services and system perspectives. One opportunity is around measuring common outcomes. And this again goes to the beyond housing theme. When I was in the US government, part of my job was to help facilitate the creation of a US interagency framework for ending youth homelessness. And a big part of that framework, if you go on to USICH's website and you'll see it, is that we identified 4 core outcome areas. They included stable housing, but also permanent connections, social emotional well-being, and education and employment. That was really intentional and harder lift than you might think, working across federal partners to establish that. But it really sent the signal that to end youth homelessness, we have to focus on more than housing alone, especially to prevent homelessness and to prevent young people from coming back into homelessness after they've exited. We have to think about their fuller development. The problem was we never indicated, because we really didn't know at the time what were the best measures for each of those 4 areas. So it's been kind of the Wild West ever since on how communities are measuring them. We at Chapin Hall partnered with Youth Collaboratory and over the last year did an evidence review and lots of consultations across the country to identify scientifically valid and reliable, brief, publicly accessible, free measures for each of those 4 core outcome areas that we hope programs and service providers working to address youth homelessness will use commonly across communities and systems. And that way we can work towards comparing apples to apples, learning together, and thinking not just as a program, one program, what can I do? What's the result I can achieve? But where are a young person's needs and strengths, and how can we build a system response around that full need? So that's available through the Youth Outcomes Project on our website and Youth Collaboratories. And then the other answer is that we, for those of you working with HMIS or homelessness systems data, we worked with University of Southern California and published an issue brief on towards a system response to youth homelessness that gives an example. We worked with 10,000 data points across 16 communities to show how you can do equity analysis with youth homelessness systems of data and look at a range of outcomes on which young people are doing better with what placements, how long young people are waiting, and how equity plays in. And then for those of you in schools, we're now implementing what I mentioned before, this kind of Nike Vaporfly shoe, the universal screening instrument to be able to get ahead of the challenge, not just wait for youth to experience homelessness, but to identify risk and protective factors related to homelessness and school dropout so that schools with their community partners can move upstream and work with those students earlier. It's also meant to increase identification of students already experiencing homelessness by taking a universal approach and not just waiting for under-resourced systems to have to identify those students.
Hi, my name is Rebecca Beach, and I manage the program serving children experiencing homelessness in Cincinnati. And I've been hearing a lot about universal screening tools at this conference, and just wondered if you could talk a little bit more about that, if you already have one that you use or recommend, or.
Cool, that's cool to hear. Yeah, there are different universal screening tools being used for different purposes, some for like mental health, for example. So in King County, the Seattle area, they're using an ESPERT, what's called ESPERT instrument. I don't remember exactly what it stands for now, but around mental health in schools that they're now starting to roll out as universal screening. Ours was adapted from the Australian version that's used, but it uses common, valid, and reliable measures around things like family conflict and household stability and young people's previous systems involvement and well-being and mental health and social connections and school engagement to be able to identify which students are more at risk for homelessness and school dropout. We've just piloted that for the first time with one school district in Minnesota, and so we're glad to have gotten through that for a first time in the United States, and now we're working with 3 other communities to continue to roll that out. And so we can talk with you about that tool. We customize it a little bit for every community that we partner with. We generally don't advise just using the tool without the fuller program model so that those students are supported. So if you're interested in that, let me know. We can talk about the fuller program that's involved.
Good afternoon. This is a very cool microphone.
It is.
So thank you so much for speaking with us today. My name is Kieran Taylor, and I work with Unanima International, which is an international NGO that advocates for women and children at the United Nations. We are part of an NGO coalition to end homelessness globally. And so I'd like to know, coming from a multi-stakeholder perspective, where you have been involved in governmental work, you have a personal connection, you've been in academia, what would you recommend that internationally we look at intersectionally? Meaning, what are the most important intersectional elements? You've mentioned race, but beyond that, what would any analysis of family homelessness have to include? Thanks.
Cool. First of all, you should meet my wife. She works for UNICEF.
Hello.
And so the second of all, I used to work for the World Bank and still do some work. So I've been moving back and forth between the international and the domestic space. And I found that actually we in the global north have a lot to learn from the global south. And one of the, so I'll get to that question, but I used to work in Afghanistan and still do some work. And one of the things I was impressed by in Afghanistan, one of the poorest, most conflict-affected countries in the whole world, was the ability to think big. We're here tweaking on the margins of failed systems and policies, whereas in Afghanistan, they're thinking about a whole women's economic empowerment program at the national level, a whole new social protection system. So I think in some ways, we have a lot to learn in the other direction. And I'd also say, one of the things that I learned working in India was that, the intersections can be different. So it's really important to track trend data over time. And to figure out how different groups are performing. So one of the things that we saw in India, for example, was that among adolescent girls and young women, human capital outcomes over time were pretty bad among those who were in the lower scheduled caste groups, as well as the tribal population. But when you collect trend data, we found that among scheduled caste young people, and particularly young women, human capital outcomes were improving. So something was working. Tribal outcomes were remaining fairly flat. And so that prompts a question about understanding the local context for those intersectionalities. So I think they're very country and context specific, but I think even in our own country, we think it's really important to capture national estimates on youth homelessness, not just this one time, but every few years. And that way we can track progress at the intersections of different marginalized identities and really incorporate qualitative research and people with lived experience to help guide the way that we interpret those data. So I don't think there's a cookie cutter response. I think that those intersectional identities and different axes of marginalization play out differently in different contexts. But to be aware of working with people with lived experience and from the communities in each of those countries to start to understand where those intersections might exist, and then tracking data across them over time to see how progress is playing out.
Hi, my name's Steve. I'm a retired teacher from Seattle, and I've always been interested in brain research. And you started your presentation with that, and I was wondering if you knew of any brain research being done now specific to homelessness and trauma.
It's a great question. I don't really know. I think there's been more that's been done around youth and foster care, and I think any Casey Foundation, Casey Family Programs has really supported that. So we're seeing some more work emerging out of youth in transition and instability and with prior experiences of trauma. I'm not aware of much, and others in the room might be, brain research or neurobiological research right now around the experience of trauma or homelessness. I think it's a great question.
Hi. So as you're working with like large macro data sets and you're tracking these large complex issues like homelessness, and you're tracking like, you're seeing a reduction or you're seeing increases. What are some of the things that you are, and so you're tracking large complex problems, and you're tracking the large complex systems that are trying to tackle those problems. Or what are some of the methods that you're trying to use to control for or to try to sort of parse out what's actually making a difference and what is just like, noise?
Yeah, that's a great question and really hard to answer. It's much easier to be able to figure out causal effects at the program or the intervention level than it is when you're talking about systems change. And that's a question that we're grappling with now. It can be done, but it's often harder, more expensive, and involves, or you could use administrative data. So without getting too geeky, one of the things we're exploring is, there are big data sets that exist, and can they tell us something? Like census data, American Community Survey data that's captured at the community level, capture some issues, some data on housing. If we're implementing systems reform in certain areas and not in other areas, can we look at trends over time and use existing administrative data to help us see how those trends are playing out? It might not be as perfect as a randomized control trial in terms of causal identification, but it can tell a pretty compelling story for the data that you have, and it's much better than what we've got. But I think what we don't want to be in is a place where we're just doing lots of systems change. Given our history of systems change in the United States that's been often leading to adverse outcomes and racialized outcomes, we don't want to do it without a plan. We want a plan for capturing data and iterating and having conversations on that data over time. So I'd say look at the different facets of administrative data that you have. Think about comparisons that you can make, and sometimes that's longitudinal. So if you've got administrative data like on schools, so where we're doing the Upstream project, we might have chronic absenteeism for the last 6 years before a project started. And if you see a dip in chronic absenteeism right around when the project starts, that's a pretty good sign. And then we want to start building in qualitative data collection to understand, what else might have been going on that could be explaining those outcomes and what might be the drivers of those outcomes over time. It's a hard question.
Hi, Marcia Baslow with Child Care Services Association, and I'm thrilled that you have your own little 3-year-old so that you can see what's happening in the brain development. You did a great brief on pregnant and parenting youth, and I'm wondering if you are going to be looking at any more in the early childhood world.
So we would love to, is the short answer. And for us at Chapin Hall, one of the nice things about working on youth homelessness is we've got counterparts that specialize in early childhood development, well-being, and trauma in school systems and family homelessness. So that's an area we would like to be going deeper. We don't have a specific plan at the moment.
Hi, Matt. I can imagine that the notion that prevalence rates are comparable in urban and rural communities is often met with disbelief or rejection of that possibility. Thoughts about how that's been fielded in communities that you've worked in, or ways that we can actually make better use of that critically important finding?
Sure. I think In rural communities, the reaction is usually duh. I think you're right. And the other, among many who are used to a certain perception of what homelessness looks like, homelessness is people under a bridge or in a street corner or it's in a shelter, have a hard time grappling with that. And so I think one of the things that we're really finding is that it's important to convey data and information about the experience of homelessness and that it can look different ways in different communities. And when we look at administrative data from homelessness systems, it's really important to look at that data. We do it all the time. But that data is necessarily biased because it relies on the systems that it's in, shelters, right? So if you're seeing a higher share of people in shelters, or if your youth point in time counts are largely driven by the participation of shelters, well, you have what researchers call, bless you, sampling bias. You've got a bias that's built around those shelter systems. And in communities that don't have shelter systems, then they're naturally going to be undercounted. And so that really has to be grappled with. When you look at point-in-time count data, it shows 50% or more of youth experiencing homelessness in shelters. How many of us really believe that right now, 50% of all youth experiencing homelessness across the country are in a shelter? There's no way, right? So I think when we sort of play that out in the logic and we start to humanize what homelessness looks like and how that trajectory unfolds, it starts to make more sense. But it does often take working through some initial knee-jerk reactions and painting a more detailed picture of what those experiences are.